This morning on Today's Health, medical breakthroughs for 2011. From progress in detecting Alzheimer's disease to fighting melanoma, physicians at the Cleveland Clinic nominated innovations they felt would change the face of medicine at the clinic's 8th Annual Innovation Summit. And today, contributor and medical editor of Health Magazine, Dr. Roshini Raj, is here to walk us through the breakthroughs. Dr. Raj, great to see you.
Good morning.
Good morning. So all of these medical breakthroughs are approved or about to be approved by the FDA. We've got a lot to get through, so let's go through them one by one. Number one, we're talking about something that can help you early detect Alzheimer's disease.
Right. This is so important because currently the treatments for Alzheimer's don't work very well, mostly because once you have symptoms of memory loss, it's really too late. This technique can actually detect Alzheimer's about 10 years before you're going to develop memory problems, so that's going to really open the door for new research and new treatments.
It's a new technique the doctor uses. Are you talking technology that they would use?
Right.
It looks like a scanning device?
It's a PET scan for the brain, but it's a new compound that's actually going to, latch onto those plaques in Alzheimer's, so we can actually diagnose it.
So people who have this in their family?
Yeah, it might get to the point where everyone's screened for it because this is a very common disease.
Melanoma. It's a very serious cancer.
It's the most deadly form of skin cancer. It's one of the cancers that's actually rising in incidence and is becoming more deadly, so we're going in the wrong direction. Any treatment, new treatment for melanoma is really welcomed, and this is an immunotherapy. It actually helps your own body's immune system fight the cancer.
Okay, so it's a drug.
It's a drug. It's very exciting for late-stage melanoma because right now the survival is only 15%.
Okay, for prostate cancer sufferers, there's a therapeutic cancer vaccine that actually can help you if you're a survivor?
Yes, this is to fight off prostate cancer. It's also for later stage prostate cancer. That's the second leading cause of death in men for cancer deaths. So this is very important. Again, once prostate cancer spreads, it's very tough to treat. And this is a vaccine where it takes the patient's own cells, grows them out of their body, puts them back in a boosted way that it's going to fight the cancer specifically.
So that's exciting.
Yes.
Okay, now there's a study that helps with heart disease.
Yes. So there's a study that showed that statins, or the cholesterol-lowering drugs, can actually help people in terms of prevention of heart attack even if they have normal cholesterol. About half of people with heart attacks do have normal cholesterol. So how do we help them? If they have an increased marker of inflammation, it's called high sensitivity CRP, they should talk to their doctor about getting on one of these cholesterol-lowering medicines. It was shown to dramatically reduce the risk of cardiac events.
Hepatitis C virus. There are now new drugs we think are about to be available.
Right. So right now this is a silent killer because often it doesn't produce any symptoms until it leads to really liver failure, cirrhosis, or even liver cancer. The treatments right now are okay, but they definitely do not work for everyone. It's about a 50% effectiveness rate. These are two new drugs that will add to that effectiveness rate. They're going to be added to the conventional therapy and really boost the response to it.
There are also some new devices when it comes to heart failure.
Right, so heart failure can be very debilitating and it often requires many hospitalizations. Now there's a device that's actually implanted into the patient which directly measures pressures of one of the major arteries that lead into the heart. It'll allow the doctor to receive that information and really tailor their therapy so they don't have to be readmitted every few weeks to the hospital.
A topic we talk about a lot around here, weight loss. There is now a breakthrough for a weight loss procedure.
Yeah, this is really exciting because as we know, obesity is a huge problem in this country. About a third of Americans are obese. There are bariatric surgeries available, but even the the least invasive does require incisions into the abdomen. Now we have an endoscopic option. So through the mouth, instruments are placed. They actually create a very small pouch in the stomach, and that's your stomach. So you're going to feel full very quickly and lose weight. It eventually will probably become an outpatient procedure.
Wow, that's a pretty significant statement.
Yeah.
There's now a new way to diagnose asthma.
Right, so asthma involves, as we know, breathing difficulties, resistance in the airways, but also inflammation. Until now, we didn't have a good way of detecting that inflammation. This is a device where you measure nitric oxide, which is a sign of inflammation. It'll allow your doctor to really tell if you're going to have an asthma attack in the next few days and really tailor your therapy before it actually happens.
Really, and that's bankable. That's pretty amazing. Okay, there's also now an oral treatment for people with multiple sclerosis.
Right, this is really amazing because for multiple sclerosis, it is a very debilitating disease. And right now requires either injectable medicines or an IV infusion, which is very hard for patients to adhere to. Now there's a pill form available. It's going to be available soon. It's gotten priority by the FDA because so many people are suffering, and this has shown in studies to have very good results.
And lastly, it's amazing we're getting through all of them. There's now a capsule for diagnosing gastrointestinal disorders.
Right, and this is particularly important for the pediatric population. You know, with children, we never want to be sticking tubes in them either way because it's very traumatic for them and their families. Now there's a pill endoscopy, so they literally swallow a pill about this big. It takes pictures of their small intestine. It really allows doctors to get amazing images, diagnose diseases such as Crohn's disease, celiac disease, without any pain or discomfort to the kid.
And celiac disease is very, very hard to diagnose. Listen, you know what? You got through all of them. You gave us great information. It's exciting to hear about them, and thank you so much, Dr. Roshini Raj.